All right, so my name is Dr. Mohammed Enayat. I'm a GP for about 10, 12 years now. And I've, over the last 4 or 5 years, developed a specialist interest in something we call longevity medicine, which is the science and medicine of identifying aging as a process and intervening earlier to improve quality of life in the long run. Now, the aesthetic industry actually started in aesthetics in my private medicine in aesthetics about 10 years ago. And I think we know very well how to reverse aging from the outside. We're very good at it. Different types of traumatic treatments for skin, different types of stimulation for body treatments to get the desired visual result that we want. What I'm going to talk to you today about is the application of some of these technologies for longevity for the physical body. So it's beyond just form, but also function. Now, if you guys can put a show of your hands up, just so I know who's attending and listening in with me, but who is interested in living a high quality of life when you're 70 to be cycling? Yeah, pretty much everyone, right? And I think this is what this talk is about today. It's how do we get our patients and ourselves into the notion that we can dictate how we will be living at 70 years old, okay? And dictating the quality of life that we're going to be having. So my brand, my clinic is human. Instead of the A, it's got the number 2. It's about helping people be their 2.0, the absolute best. We do a variety of things. So we do the functional personalized medicine, where we do deep blood testing, and you work with a nutritionist and a doctor of personalized health programs. We identify imbalances such as hormonal imbalances, cardiovascular imbalances that will inevitably drive disease, genetic predispositions to disease states, but also pre-disease states. And then alongside that, we've curated a suite of therapies that we have intentionally curated based on understanding how different components of the human body age. So in here, you will see one of my favorite devices, the high pressure oxygen chamber. You'll see the M cellular chair here with the VO2 max there. You've got the M face there. We've got many more devices. So this is really handy, the screen down there. So, what we're trying to ultimately deliver with my brand, and what I think is the future of aesthetic medicine as well, if you're looking to the future, is that your patients not only want to look good, they now understand there are options for them to feel good for the future. And if you as a practitioner or as a business are not engaged with that notion, even at the philosophy level, then I think that your time as a practice will become outdated. So for us, it's very important in the way we deliver healthcare that we're talking to patients about their quality of life. Even when we're talking about skin and facial aging, maybe less so, but we're talking about how this may impact their quality of life. And then what I want you to start to do through this talk is to think about how different parts of this human body will be deteriorating at different rates. And then look at the tools around here as you go through this conference and other conferences and say, okay, will this tool reverse this part of my aging process? Be it hormonal imbalance, be it bone degradation, be it muscle mass loss, right? There's many other forms of aging. But one of the things that's underspoken about is physical deterioration, and it's inevitable. If we think that we're not going to get arthritis when we're older, and we're going to somehow, be lucky enough to not need a hip or knee replacement if we live to that age, we need to really appreciate that decline of the body is inevitable. Obviously, it depends on how we live our lives, but the rate of deterioration will be different from person to person according to that. So we know that rapid mortality is associated with hip fractures. We know that women are more likely to get hip fractures. We know that women around the time of the perimenopause go through an accelerated bone loss compared to men. And for us doctors or healthcare workers here, We know, we've been in hospitals when we see a fractured neck of femur at 70, 75-year-old plus, we already know that the outcome's going to be terrible, right? So we want to be maintaining not just bone strength, but the muscles that sit around the joints to preserve the joint. When you have knee pain, you go to a physio. The physio doesn't work on the bones or the joint itself. He works on the muscles around the joint. So if we want to improve knee pain, if we want to improve back pain, we want to improve the muscles. If we want to prevent arthritic or deterioration of that joint, we want to be working on the muscles around the joint. This is a really interesting, this is something that the colleague of the future fellows report put together. Well, life-size named doll called Emma. They're predicting what some of their physical body will look like from overworking at a desk. We're very sedentary. We've never been more sedentary, and we're only going to get more sedentary over the coming years. We're seeing in general practice people coming in with arthritis of their thumb joints. We're seeing more varicosity because poor blood supply, stasis of blood flow. And we're seeing kyphosis of the spine because this unopposed spinal movement. Unopposed being the muscles aren't strong enough to counteract the changes and the pressures being put on the spine. These will inevitably impact quality of life. So we're going to talk briefly about a couple of the major organs, the musculoskeletal organ. There's a 3 to 8% decline in muscle mass per decade from 30 years old. There's also, in similarity, there's a 5 to 10% decrease in VO2 max from 30 years old. That's our ability to take oxygen and make energy, cardiorespiratory fitness. There's also approximately 3 to 5% decline per decade in bone mass as well. So if we just have a look at this, I'm going to skim through this quickly, but the reason why we need high quality muscle, and actually when we look at BMI, it's a bit outdated. What we need to be looking at is body composition, the percentage of our body composition that's muscular versus fat. Because we know if we have more fat, it's more pro-inflammatory, it drives more disease, you will, you'll get faster onset of morbidity and mortality. The other thing to understand is in the dense muscle fibers is where our mitochondria sit. So as we get older, if we don't use it, we lose it. And one of the things that we lose in the muscle mass is the number of mitochondria. Mitochondria, for those who remembers mitochondria, just a few of us, amazing. Actually, quite a few more heads. Mitochondria is a term that I would love for you to spend a bit more time on, because cellular energy production is the secret sauce to longevity. Anything that you can do to improve your ability to take oxygen and make energy at a cellular level will improve your cellular repair, your cellular replication, your cellular mechanisms, which ultimately will give you better outcomes in skin, hair, body, any of the goals that you're working on. So the denser your muscle, the more mitochondria you have. So we know, as I mentioned earlier, there is a loss of muscle mass as we get older. This sarcopenia is the description of that. Partly because we don't put on muscle as well, the absorption of protein, delivery of that to the cells, but partly also because we don't use it. So if we don't use it, we lose it. But also we need to use it more so we don't lose it as we get older. Okay? So there's two things there. We have to work harder to retain and make muscle after 30 years old. And that increases at a rapid rate. So we touched upon the inevitable decline of the musculoskeletal system. And this is, this is driven by lifestyle factors such as nutrition, how we move, digestive health, and hormonal health, as we talked about earlier, as shown by the going through the menopause, with an accelerated loss of estrogen. And so we want to be intervening. We're going to talk about some of the interventions that we can do. We briefly touched upon the fat that sits around the muscles, around the organs, but can also sit around the liver, visceral fats, intra-abdominal, very pro-inflammatory. Okay? We found that COVID was worse in patients that had more visceral fat. These were the patients that went on to have more serious systemic symptoms. So inflammation is a fire that we need to be aware of if we're thinking about long-term health. And we can do that through antioxidants, through anti-inflammatories, through stress modification, through nutrition, but very importantly, through visceral fat reduction. Okay? And this is where blood sugar control comes in, but also movement. I briefly touched upon hip fractures, but significant stat. A 1-year mortality rate after a hip fracture is 33%. 1 in 3 people die within a year of a hip fracture after 60 years old. Okay, so exercise is going to help. Exercise is actually one of the most important longevity drivers. It's been shown to switch on the most number of longevity processes when you do exercise. So nothing can beat exercise. And then we got to think about the type of exercise that we're doing. So we're going to skip forwards, and I'm going to talk to you about the exercise that we will do and the technologies and the applications of these technologies. So, I'm working with BTL just more recently, but I invested in these technologies in my clinic I've had them as a suite for about a year. And a lot of my patients come to me for longevity. They come to me and my team to create personalized strategies to live stronger for longer and to reverse their early disease states that they may have got in. Okay, so I curated a bunch of technologies, but some of them in my clinic include the M-Cellar chair for inevitable pelvic floor decline, the M-Sculpt Neo. We use that on targeted areas to prevent the inevitable decline of those, and I'll tell you how I'd use them in protocols. And then we also do the M-Face because patients also like to age well externally, and that's why a majority of us are here today. But BTL, interestingly enough, grew in the physiotherapy industry. They understand muscles very well. And I know their machines are expensive, but the results are also very, very good. They're high quality results and they're very, very safe technologies to deliver on patients. So when I was choosing to invest in the equipment, I was like, price, quality, outcome. I'm very much focused in my practice about quality and outcome. For me, that is what I believe gives us longevity as a brand. Is our patients referring other patients and coming back in once you give them those transformations. Who knows about the M-Sculpt Neo here? Okay, not a few. So M-Sculpt Neo is electromagnetic, high intensity focused electromagnetic energy combined with synchronized with radio frequency. Who's heard of radio frequency? Okay, many of us. So radio frequency is a type of heat energy, and it can be used. You can deposit it through needles, or you can deposit it transdermally through an applicator, and it sends waves of radio frequency there, which ultimately heats the tissues. High intensity focused electromagnetic energy. Who's used electromagnetic anything on the face or on the body before? Like the EM suits or the CACI, you might have heard of that at the most basic level. Think of that, but medical. So high intensity focused electrical magnetic waves of energy that go deep to deliver deep contractions. And this is just showing that BTL have delivered over 3 million treatments, and there's high quality of studies out there. So it's the first muscle sculpting technology in the aesthetic field that simultaneously operates with radio frequency heating. Okay, so you heat the tissue, you can control the settings for this. The heating the tissue, if you're applying it for sculpting, will cause some fat reduction. But more importantly, you're toning and building the muscles underneath the fat. What's really interesting is that when you go to the gym to push weights, you can only push yourself to a certain level. That's known as voluntary contraction, because there is a pain threshold that kicks in and that prevents you contracting the muscle to its full potential. with this technology, you can go beyond the voluntary contractions to supramaximal contractions. Okay, so these are really powerful contractions that you just cannot do by yourself. This just shows the depth of the layers typically. And I'm going to talk about our application for longevity now. When I talk to my patients 45, 55, 60, for longevity, I'm talking about maintaining function of their hamstrings, their quads, so their posterior chain, so you can counteract the kyphosis. You can create space between the spinal discs that over time they cause impingement. If you have weak muscles, the nerve roots and the nerves impinge, causing sciatica, extremely debilitating, and maintain muscles around the knee joints. The primary knee joints being the the knees. I combined them. The knees and the hips. I'm trying to save time. So, how do we do that? The glutes, and we position them as you go through, and you go through the training, but also as you work with more and more patients, you'll understand how to slightly vary the positioning of the applicator to deliver the direction of electromagnetic energy to activate the fibers that you want to activate. Okay, so the gluteus, the quads at the front, the hamstrings at the back, and sometimes the calves as well. And importantly, the abdominal wall at the front and the flank muscles on the side. Patients that are doing this with us are getting, if they're coming in with symptoms, be it reduced mobility, reduced function, we're seeing significant improvement in quality of life from a course of treatments. And my eldest patient who's done it is about 75, and we're also applying it all the way to the younger. I'm working with an Olympic athlete who had a ACL injury. Now, in ACL injuries, you can't load the joint anymore, can't flex because the ligament needs to heal. So you can maintain the muscle mass by stimulating the muscles using techniques like targeted electromagnetic waves of energy. So the athlete end, at the high performance end, or at the longevity end, as a physician, I find this a phenomenal tool. What are my other options? Patient comes in with back pain, sciatica, reduced function, reduced quality of life. What can I do? I can refer them into the NHS or privately, have an MRI scan. They go see a surgeon. What are the surgical tools? Operations. There's normally a long wait. There's a long recovery. 6 months to recover from a knee op. If you're lucky that you get your full recovery pre-morbid state back. Okay, so you can get something like this and very quickly reduce, try it out, see what results they get, improve their quality of life. Obviously, they need to maintain that, and you can start to work on different protocols on the age. You'll also work on improving retention and creation of muscle. I'll come to that on the end. We talked about this. So your spine, to maintain good spinal positioning, you need to have your abs and your glutes going into the psoas as well. Now, with the applicator, we don't go up into the back muscles, but we can go round very well. So some of the evidence is that you get 24%, 25% more muscle deposition from a treatment course. You get a 30% reduction in subcutaneous fat, and you get a 20 up to 18% reduction in visceral fat. Visceral fat is very hard to remove. You need to exercise, and you need to watch your nutrition. Now, what happens if you can't use your joints very well? You can't exercise. It's more difficult. Okay, so suddenly you're coming up with ways and solutions for your patients. They're going to think, wow, you're not just thinking about me to look good. You're thinking about me to feel good. You're thinking about me to function better. And this, for me, connects why I became a doctor or a healthcare professional, is to ultimately get people feeling and experiencing health better. And so you have an opportunity in your practice to reconnect with that. You obviously could do that through aesthetics by, when people look good, they feel good as well. But that's short-lived if they're dealing with back pain, if they're dealing with joint pain, if they're dealing with nocturia, needing to wake up to pass urine at night because they can't hold the urine, which I'll come to in a second. With some of the results, I'm kind of skipping through them. I shouldn't really, but please do visit the stand. BTL have some excellent, they have excellent team members there that will be able to show you some of the results. You can apply it for biceps, triceps, calves. These are just the visual effects, but the functional effect is what I want you to meditate on. Close your eyes. Think about the functional effect. Think about when you last did a deadlift and how strong you felt when you're repeatedly doing deadlifts. That's how you get your patients to feel. They may not have done a deadlift for 20 years, but they can get those results. I'm running short on time. My fault completely. I want to sincerely apologize. But just do want to say that nocturia, needing to wake up to pass urine at night, is inevitable part of aging. 55, 60 years old for men, sometimes younger, we need to wake up to pass urine. How disruptive is that to our regenerative deep sleep, through which we produce stem cells and through when we self-heal? So this treatment can be used to treat polyuria caused by, or nocturia caused by, a weak pelvic floor, which is the vast majority of cases are associated with it. So some of the symptoms, associated with stress urinary and urge or mixed urinary incontinence. So with a protocol with BTL, with two devices, you could treat the whole functional body, the muscles, which would preserve the bones and the joints. Again, there's a huge amount of evidence, but in terms of quality of life, the time to up and go has been shown to be a very strong longevity indicator. To be able to get up from your feet and stand up. Your grip strength is also very important. Balance is very important. 76% of patients were able to perform their activities of daily life better. You're giving functional independence to your patients. That is so powerful. And, it's, for me, it's been worth the investment just to see the quality of results that I'm getting with my patients. And just the final note, the face has muscles too. What I really like about the M-Face, it's the first technology that non-surgically lifts the face without needles, without threads, without surgery. Now, patient selection is everything, as with all of these tools. Think about your patients, think about who you recruit, and think about who you want to recruit, and then devise your investments accordingly. So phenomenal results that you can see with the right patient here. So just to summarize, improve balance control, risk of falls, prevent as well as reverse the loss of muscle mass. Does reverse the loss of muscle mass because you're building muscle. It improves the ability to exercise, so you can give people a baseline that they can then thereafter go and do those functional core exercises. The Kegels, the deadlifts, the squats. Okay? And reduces visceral fat, very important for longevity, and reduces incontinence. Now come over to the stand. I think I've run out of time. If you've got any questions, I'm going to be here for a little while. I've left my email on the slide as well. And what I want my patients and everyone to really think about, how you live now is how you will live in the future. It's just the same as skin. How you treat your skin now is how your skin will be in the future. Over and out. Dr. He's done. We'll go across to the stand for Q&A because I think I've got to jump off here. Thank you very much for your attention. Thanks a lot.